Hello, dear listeners. You're tuned into the Everyday Health Podcast with me, Dr. Harold Whitman. Today's topic is both practical and, trust me, vital for everyone, the health of our kidneys. Even if you've never been diagnosed with something like chronic kidney disease or kidney stones, this episode is for you. Kidney health is the key to energy, clean blood, stable blood pressure, and that deep sense of balance inside, which we often take for granted as we rush through daily life. Our kidneys are the quiet workhorses of our bodies. They filter blood, remove toxins and waste products, regulate water balance, help produce hormones, control blood pressure, and even support bone health. Without healthy kidneys, it's impossible to imagine living without significant restrictions. But here's the catch. Most of us only start paying attention to our kidneys when serious symptoms show up, or worse, when something life-threatening happens. Why? Because kidneys can compensate for problems for a very long time, sometimes until the point when complex treatment or even dialysis is required. But our goal is not to wait for trouble. We want to prevent it, right? Today, I want to talk about simple foods that can actually help your kidneys work better, protect them, and even support recovery after stress or illness. Yes, I'm talking about fruits, but not just the usual eat more apples and pears advice. I'll share the science, my real-world experience, explain how these fruits work, and hopefully give you some practical tips you can use right away. We have 3 heroes in today's episode: cranberry, watermelon, and lemon. And I promise after this episode, you'll never look at these familiar fruits quite the same way. Let's start with some perspective. Chronic kidney disease is incredibly common these days. If we look at global statistics, about 1 in 10 adults has some form of impaired kidney function. The reasons are clear. Diabetes, high blood pressure, excessive salt consumption, dehydration, and even a sedentary lifestyle all play their roles. Infections, some medications, and of course our usual diet are also big contributors. I remember one of my patients, a story that stuck with me. He was 38, worked in IT, seemed healthy. Then he started experiencing constant fatigue, brain fog, and swelling. Thankfully, he didn't ignore the symptoms, came in for a checkup, and we found early signs of chronic kidney disease. What did we do? Changed his diet, reduced salt, encouraged more movement, but one of the key changes was adding specific fruits to his daily menu. Why? Because those fruits helped boost his metabolism, reduce inflammation, and support the body's natural detox processes. So, how exactly do our kidneys keep us clean inside? Many people imagine kidneys as a sort of water filter, but really, they're a full-on biochemical laboratory. Kidneys filter blood, remove toxins and waste, but at the same time, they hold on to the essentials: proteins, electrolytes, water, glucose. If these filters start to clog up, harmful substances build up in the body. Other organs suffer. Skin quality worsens, you feel weak and swollen, and things can progress to far more serious complications. The main enemies of our kidneys are excess sugar, salt, lack of clean water, and chronic inflammation caused by poor diet and lack of movement. Dehydration isn't always just not drinking enough. Sometimes the problem is that the body simply can't get rid of all the waste, especially if your diet is overloaded with salty, fatty, sweet foods or alcohol. Now, how can simple fruits actually affect kidney health? Many people think fruits are just about vitamins and fiber. In reality, they're much more. Fruits are packed with unique bioactive compounds, organic acids, flavonoids, antioxidants, and, importantly, a lot of pure natural water in a form that's ideal for our bodies. Let's start with cranberries. These aren't just wild berries or a tasty touch for juice. Cranberries have long been known as a powerful natural remedy for preventing urinary tract infections. Their unique action comes from special compounds, proanthocyanidins. These prevent harmful bacteria from sticking to the lining of the bladder and kidneys. In other words, if you regularly consume cranberries or natural cranberry juice, your risk of developing infections drops dramatically. And infections are one of the biggest factors leading to chronic kidney problems. Doctors everywhere, including myself, often recommend cranberries to patients prone to frequent infections, especially women, as well as those already dealing with kidney issues. Scientific research confirms it. Regular use of cranberries as berries, unsweetened juice, supplements, or in smoothies reduces inflammation, protects kidney tissue, and can even slow the progression of early-stage chronic kidney disease. My advice for patients: if you want to genuinely support your kidneys, try making homemade cranberry juice without sugar, or toss a handful of fresh or frozen berries into your morning oatmeal, yogurt, or salad. Another tip: a cranberry smoothie with banana and a touch of honey. Tasty, healthy, and never boring. Just a note, commercial cranberry juices often contain a lot of added sugar, which cancels out the benefits. The best option is to make your own or buy juices with no added sugar. Let's move to our next star: watermelon. This one's simple. Watermelon is a true hydration champion. A slice of watermelon contains up to 90% pure water, plus a range of helpful vitamins and antioxidants. For kidneys, getting enough fluids is crucial. This doesn't just make it easier to flush out waste, it also helps prevent stone formation, reduces inflammation risk, and even supports healthy blood pressure. But watermelon is more than just flavored water. It contains lycopene, one of the most powerful natural antioxidants, protecting cells from damage by free radicals. It also has citrulline, an amino acid that helps your blood vessels stay elastic, improving blood flow through the kidneys and reducing complications. And here's another big one. Watermelon is a natural diuretic. It gently increases urine output, but without irritating the kidneys, causing dehydration or upsetting your mineral balance, as some medicines do. During summer, when watermelon is in season and especially good, I always recommend watermelon snacks between meals, especially for people prone to swelling or with mild blood pressure problems. It's also great in summer salads. For example, mix watermelon chunks with cucumber, a bit of mint, some feta cheese, and a drizzle of olive oil for a perfect, refreshing lunch. Research shows that eating watermelon regularly can lower the risk of kidney stone formation and support urinary tract health, even in people prone to chronic infections. A word of caution: if you already have significant kidney failure with fluid retention, always talk to your doctor before increasing watermelon in your diet. Finally, let's talk about lemons. Lemon isn't just about vitamin C and a refreshing sour taste. It's a real kidney protector against stone formation. The secret is citric acid. It increases citrate levels in the urine, which binds calcium and keeps it from forming crystals, the building blocks of kidney stones. This is probably the simplest and most accessible way to prevent kidney stones, especially if you have a family history of them. From a scientific standpoint, this is well documented. Daily lemon water genuinely reduces the risk of stones and helps your kidneys do their filtering job. How should you drink lemon water? It's easy. In the morning, on an empty stomach, squeeze the juice of half a lemon into a glass of warm water. You can add a spoonful of honey or a few mint leaves if you like. Lemon is also an excellent ingredient for salad dressings, marinades, or tea. Just remember, if you have stomach problems or high acidity, don't overdo it. And of course, lemon water isn't a magic bullet. It's one important piece of a holistic approach to your health. People often ask me, can I combine all these fruits, or is that too much? My answer, you can absolutely combine them. In fact, variety is always good. For example, in summer, use watermelon as your main source of hydration. In spring and fall, focus more on cranberries, and lemon can be a year-round staple. Of course, everything in moderation. If you eat a kilo of watermelon daily and then wash it down with a liter of cranberry juice, you probably won't get extra benefits. Everything needs balance. It's better to include at least one of these fruits every day, rotate them, listen to your body, and pay attention to how you feel. Let's get practical and go over some frequently asked questions. Some listeners worry, "Doctor, aren't fruits just sugar? Isn't that bad for the kidneys?" Yes, fruits contain natural sugars, but unless you have severe diabetes and aren't overdoing it with sweet varieties, moderate consumption is only beneficial. Cranberry and lemon are not particularly high in sugar, and even watermelon, for all its sweetness, is low in calories and sugar per serving. Another question: can I eat these fruits if my kidney function is already reduced? In most cases, yes, but it's always individual. For example, with severe kidney failure, you may need to limit fluids and potassium, which is fairly high in watermelon. So, with these diagnoses, always discuss dietary changes with your nephrologist. A third common question: how else can I support my kidneys besides eating fruit? My advice: watch your salt intake, eat more vegetables, less red meat, avoid too much alcohol, and get regular checkups. Move, get outside, drink enough clean water, and learn to listen to your body. And, of course, I want to inspire you to be more mindful about your nutrition. Instead of snacking on chips, processed foods, or soda, try adding a bit of cranberry to your morning yogurt, make lemon water, or enjoy a juicy watermelon snack. These are simple steps, but over time, they make a real difference. I've seen so many people in my practice stop the progression of early kidney problems just by changing their habits and diet, and fruits always play an important role in those changes. Some added cranberries and stopped having urinary tract infections. Others swapped sugary drinks for lemon water and gradually lowered their blood pressure. And some simply started moving more and using watermelon to dilute their diets, and their well-being improved almost before their eyes. As we wrap up, I want to remind you, your kidneys are the filter of your life. We often take them for granted, but they deserve as much care and attention as your heart or brain. Give them the chance to work well for years. Support them with simple, natural foods. Take care of your body. Don't ignore signs of fatigue, and get your health checked regularly, not just once in a while. If, after this episode, you start thinking about your diet, pay attention to your kidneys, and maybe even try adding cranberries, watermelon, or lemon to your meals, then I've done my job. And if you have your own stories, recipes, or tips for kidney health, write to me. Share your experience on our podcast website or in the comments. I'm always happy to hear from you and get new questions, because it's you who inspire me to search for the most effective, simple, and real ways to support your health. Thank you for joining me today. You've been listening to the Everyday Health Podcast with Dr. Harold Whitman. Wishing you strong health, lightness in your body, and clarity of mind. Take care of yourself and your kidneys. Until next time.